Hello, and welcome to the Valley. Today, I am your host, Janet Michael. Next week is National Health Center Week, so I am on the Zooms today with Bradley Kirkland. He is the marketing manager for Shenandoah Community Health. Bradley, thank you for taking some time to join me on the Zooms and educate me a little bit on community health centers today. I appreciate it.
You're very welcome, Janet. Thanks for having me.
So before we get into the weeds on how Shenandoah Community Health is celebrating Community Health Center Week, can you tell me a little bit about what community health centers are?
Yeah, these centers were set up as part of Lyndon Johnson's War on Poverty. Citizens and doctors recognized the critical need for affordable primary care in underserved populations. Shenandoah Community Health actually began as a migrant healthcare center and then grew from there. About a year later, they became Shenandoah Community Health, and we've expanded our services and communities ever since then.
You were telling me a little bit before we started officially recording about some of the healthcare services that you offer through Shenandoah Community Health. It's a pretty long list.
Yeah, absolutely. We concentrate on being a patient-centered medical home, which is just a fancy way of saying we can take care of all your primary care health needs in one place. Primary care for adults, primary care for children, women's health services, behavioral health services. We have our own pharmacies and our larger clinics, and those are discounted pharmacies. They're called 340Bs. And a lot of times you can actually, if you're a patient of Shenandoah Community Health, you can find a prescription cheaper under the federal program than under your own insurance. So we take care of all the major primary care needs and then work with local hospitals and clinics and everyone around to then find them specialty care doctors as needed.
And when you talk about an underserved population, is that based on income levels? Is it based on how rural the community is that they live in? What are some of the qualifications for that?
Actually, just what you said is a good explanation. Communities that are farther away from major hospitals or regular doctor offices, the migrant population, when they come to work on local farms and our apple orchards out here, we need to make sure that they get health care as well. And a lot of it is preventative, because if you can catch issues and things before they progress and you need major medical attention, you have better workers and you save money. It's just a great benefit. Also, the homeless community. As a federally qualified health center, we don't turn away anybody for their ability or inability to pay. So if you come to see us, we are going to take care of you.
I would imagine that you see quite a diverse group of people throughout the centers. You have one in Martinsburg and one in Winchester. I imagine there's a pretty diverse population that comes through those doors on any given day.
Yes, absolutely. And I think that kind of leads to a misconception that I hear a lot, in that we're only for underserved populations or only for people without insurance. I myself have insurance through my wife, who works for another company. I see my primary care doctor and get my prescriptions at Shenandoah Community Health. Works like any other place. If you have insurance, you pay with your insurance. If you don't have insurance, we have sliding fee scales to help you out. Even if you don't have insurance, I know we were talking about this earlier. Say you went to Valley Health or a Health Express clinic, and you went in and you paid with your insurance. You have insurance, but they only pay a certain amount of it for you. So you're left with the rest of the bill, depending on your deductibles and everything else. If you had done that through Shenandoah Community Health and your insurance pays for it, based on your income, the rest of your bill to us is built on a sliding scale. So if you are under the poverty level, you get a discount on the payments. And then those that can't pay at all, we see them and help them.
And that's hugely beneficial, because so many people go into medical debt even if they do have insurance, because of those deductibles and what's left over. And it could be $1,000 that they still owe. But if they have, like you said, a job, maybe they're working 2 or 3 jobs and they're
Sure.
still under that poverty line, that really makes it easier for them to not be so far in debt.
Absolutely. And I know too many people now that are drowning in medical debt by no fault of their own. They live good lives and something happens, and we're all so much closer to that, which is actually ironic how these health centers were started, and we have larger and larger populations of people that need them.
It also sometimes serves as a deterrent. People may not go see a doctor at all if they're concerned about how much money out of pocket it's going to cost them. This at least serves as a means for them to still seek medical attention and get quality health care without that worry. So maybe they're more apt to do it than they would have been otherwise.
Absolutely. I know that I've had to make those decisions in my life several times. It's like, do I go to the doctor and I know I'm going to have to pay for it, or am I going to put gas in my car to get to work today? So if you could take away that worry, okay, I'm going to get gas, drive to the health center, go to the Health Express, which is another aspect of the health center, Janet, I'm sorry I didn't mention before. Just like a clinic where you can come in anytime without an appointment for emergency needs. We have 2 Health Express clinics in both locations.
It also sounds, from a convenience perspective, pretty sweet. If I am a mother
Uh,
of 3 children and I have one place that I can now go to get my health care, to take the kids, it seems like it's so much easier to do it that way.
yeah, exactly. And let me paint another scenario which makes it all even cooler. You do all of that. You get seen for you see your primary care doctor, your kids see the pediatrician, you get a couple of prescriptions, you walk down the hall within a few minutes because we prioritize prescriptions in the clinic. Within a few minutes, you go to the pharmacy and you're walking out the door with your prescription as well.
That is
So,
amazing. No getting in the
right?
car and driving
No,
somewhere else and doing
no.
waiting for it to be ready or not be
Or
ready
if
until the
it's
next day.
ready, right, it's not in stock. We'll have it for you tomorrow. Well, I'm about to die tonight. I need I need my calcium, magnesium. I'm gonna tingle, and it's I don't know. It doesn't have to be so hard. That's why I just love what we do, how it's there. I've taken full advantage of seeing doctors and getting prescriptions. I'm an introvert by nature. If I have a prescription waiting for me somewhere, the last thing I want to do is go and get it. But if you prescribe it to me that day and I walk down the hall and 20 minutes later it's done, it's cool, it's done. All one chore, I got it over with. So there's those conveniences for introverts, but then also, you know what you were saying, Janet, a mom with a lot of kids and a lot of errands to do, and it's hard.
You
This can make it a little bit easier. And
You were also telling me before we started recording that there is a component of case management. So, say you've got that mom and she's taken her kid to the pediatrician and they need some follow up. And sometimes, even the best of intentions, us moms let things go because the kid's feeling better. You got the prescription, he's feeling better, and maybe we just don't have time right now to schedule another appointment. You guys really stay involved in the patient's care to make sure they're getting those follow-up appointments and staying in touch with them.
yes, because we're a primary care health center, we often have to send people out to see specialists or for surgeries or things of that nature. We make those referrals and we send them out, but then we check back and make sure with the specialist that they saw the specialist. And if they did see the specialist, great. So then we'll get back in touch with them and make sure after we've spoken to the specialist what's the best plan going forward, get them back in to see their primary care doctor and really just manage the whole situation. Again, not because people can't do these things, but like you said, there's a million other things going on. Let your health center help you take care of yourself. So we see their whole journey, and it's a team effort by them and us together to look after their health.
It really does seem like a full circle of healthcare.
Yeah, it's nice. See, now that patient centered medical home just makes sense when you know all the details.
Let's take a break. When we come back, can you walk me through
Yeah,
some of the activities and things that you're going to do to celebrate National Healthcare Center Week next week? Can we talk about that in the next segment?
love to.
We're on the Zooms today with Bradley Kirkland. He is the marketing manager for Shenandoah Community Health. Next week is National Health Center Week. So Bradley's going to walk us through the schedule of really cool, fun, educational things that they have going on when we come back in just a couple of minutes. Got a few hours to give? You could make a local nonprofit's day. On September 19th, United Way NSV invites you to join over 900 volunteers for Day of Caring, the region's biggest single-day volunteer event. You'll help nonprofits across the valley by painting, landscaping, organizing donations, or doing light repairs, whatever's needed. No special skills, just a willingness to help. Whether you're solo or part of a team, your time will make a real difference. Sign up today at unitedwaynsv.org/Day of Caring. Be part of something bigger. Help us care for the Valley together. Welcome back to the Valley today. I am your host, Janet Michael. Next week is National Health Center Week, so we are on the Zooms today with Bradley Kirkland. He is the marketing manager for Shenandoah Community Health. In the first segment, we learned a little bit about community health centers and in particular what Shenandoah Community Health does. Bradley, you were telling me during the break that there are not a lot of centers, but you serve a lot of people for the 1,500 centers there are nationwide, like millions and millions of people you serve.
Millions. Yeah, it's 32.5 million people. And a lot of those are 1 in 5 uninsured people, 1 in 3 people living in poverty, 1 in 5 rural residents, 9.4 million children, and another interesting demographic, over 400,000 veterans.
Wow.
So that's through all the community health centers nationwide.
Guessing that you probably have a lot of partnerships with other nonprofits and other healthcare systems and things like that that you partner with in order to offer the most things to the most people.
Yes, and it's been the name, right? Community health. So we're there for our community, and our community is not only our patients, but local organizations. We do a lot of events with local ministries. We also work on events with West Virginia University Medical Center, with Valley Health, local churches. It's a total group effort, I think, and it's a nice community to be part of.
You have events like this National Health Center Week. It's great to be able to toot your own horn a little bit, but also to make sure that if somebody is out there that has no idea that you exist or what you do, this gives an opportunity for them to get that education.
Yeah, and that is all part of Health Week. It's a national celebration, all of the things that we do during the year, all of these health centers, and here's who we are, here's what we do, here's how we help people. So yeah, a large portion of the week is just advocating, patting ourselves on the back, like you said. There's a little bit of that, sure, but mostly advocating for what we do and letting people know we're here for you.
I love that you kick off the week with staff appreciation, at least at your Winchester location, because staff are important. They're the front facing people that are dealing with patients and dealing with clients. So I love that you want to thank them first.
Yeah, I don't know if I've read a management book that didn't start out by saying staff are your number one asset, because they are. They're your front line. They're the people talking to all of your patients. They're the ones out there writing down appointments, answering phones. So absolutely, without them, all of that stuff just doesn't get done. The doctors don't see people. Supplies don't come in. So like you said, on Monday is Staff Appreciation Day. And at our Winchester location, we're doing a cookout for the staff. It's kind of cool. So our entire executive leadership team, so CEOs, CFOs, COOs, CMOs, all the C's are going to be donning aprons and cooking hats. We'll take lots of pictures because everyone needs to see that. And they'll be out in the back grilling up hamburgers and hot dogs for the staff. And then they're going to do it 2 more times during the week at our Healthy Smiles Dentistry in Martinsburg, and then at our main location, our main clinic in Martinsburg. So we've extended that out. But on that day, we'll have department staff pictures. We have kudos from the board of directors thanking them. So yeah, we're going to go all out thanking our staff on that first day. And then the day prior on Sunday, we don't have anything necessarily going on, but we have an article that we'll publish, and we'll have all of these things on our website and social media as well. I can tell you about that later. But we'll have an article and information, 60 years of progress on community health centers. So starting all the way back when LBJ had his war on poverty and wanted to set up health centers until now, all of the things that have happened and going on. There's a really cool timeline of pictures and important events. So I'll have all that up for people to look at. Again, just educating everyone. There's a lot of history here and a lot of work being done. I don't think a majority of people even know all of the things going on with community health centers.
Do you take a day during that week and thank your patients, show some patient appreciation?
Oh, yeah, absolutely. And that is the very next day, conveniently, Patient Appreciation Day. We like to set up in the lobby of our clinics and just welcome people there. We have lots of balloons and information on Shenandoah Community Health and on community health centers. Then we have goodie bags for everyone, the little Shenandoah Community Health pens and things and nutritious snacks. That's mostly for the kids, but anyone free to have a goodie bag. We appreciate you. Thanks for coming. They're not running to an appointment or running out to get to their next appointment. We'll have a few minutes to talk about community health centers in general and more of what Shenandoah Community Health does. The very next day is Health Conditions Day. So we will have a lot of materials out in the lobby as well for people when they come in. We want to talk about primary conditions that we see most. So hypertension, diabetes, obesity, gestational diabetes. And we'll just have a lot of information available, pamphlets, handouts for anyone that's interested or wants to learn about these conditions, they can. So we're just saying, here's what we see in the community a lot. Someone might be having a symptom and they didn't know about it, and they were reading the thing and, oh my goodness, that's happening to me right now. I didn't know. I should see a doctor. It's not always obvious to everybody. So again, it's just part of our whole deal is to educate the community and help them take care of themselves. Thursday is what we're calling population focus. And since we started out as a migrant and homeless clinic, we are going to educate people about the barriers, hoops, difficulties of people when they're homeless to find any kind of medical care at all. We'll actually have a display in both of our clinics on that day showing how a homeless person would be surviving in a tent or the sleeping bag or whatever shelter they can find a lot of times. And then what are all the difficulties that they have? You can see them there in their world. How do they get health care? We're just trying to bring it to light a lot more. And we thought with the display it has an impact. Have a lot more empathy and understanding for people if you actually see their plight or understand what they're going through. You know what I mean?
Oh, yeah. People are so quick to judge. But if they are somewhat forced to think about, so what happens when someone who doesn't have a home gets sick? What happens if they get COVID, if they fall and break a leg? It's not like they can get in the car and go to the doctor. There are so many other things that compound the problem of being homeless to begin with and make it even more difficult.
Yes, absolutely. And that actually brings up another cool service that we provide. We partner with local transportation services. So both for homeless or more urban or people that just don't have the transportation, because we understand that aspect of it as well.
And that's actually how you wrap up the week is Partner Appreciation Day.
Yeah, absolutely. You know what? Because a lot of these people just do yeoman's work. It's incredible to see just how hard everybody works and how hard everyone just wants to make a difference. We're going to be thinking our corporate partners, of course, the Valley Healths and the Sinclairs and the WVUs and health departments and chambers of commerce and things like that, but then also all of our community partners from church groups that organize events. And these people are doing great things in our community. They should get some kudos as well.
Yeah, I love that you want to take some time out of that week to spotlight those, because sometimes those groups don't get any kind of recognition and they really are doing some really great work.
Exactly. Yeah. And that's why it's nice. The whole health center week, there's the National Association of Community Health Centers, which we're a part of, and they have all kinds of great materials, and they do their own press and their own media events to help get the word out as well. We don't get anywhere without great staff, and they should be recognized. And communities don't get anywhere without nonprofits and people donating a lot of time and effort. So yeah, kudos to all of them. I wish I could just name them all off, but I'll post them on the website and on our Facebook page too, so we can give them some kudos.
So if someone is listening today and they want to come by the Winchester location,
The Winchester location is 1330 Amherst Street. We're in between CVS and Museum of the Shenandoah Valley, but we're on the opposite side of the street. And we are in Martinsburg on 99 Tavern Road. So come by either location just to stop by and say hi and talk to us and learn about Shenandoah Community Health, whether you're a patient or not. We would love to see everybody.
and how can they find you online? Well, can you give me your web address and your socials?
We concentrate on Facebook. A lot of socials are good, but that one works for us. And it's at Shenandoah Community Health on Facebook. And on the interwebs, we're at shencomhealth.com. So that's SHENCOMM health.com. All one word, Shencom Health.
Bradley, thank you for taking some time today. I do appreciate it. I hope you have an outstanding week next week.
Janet, I think it'll be fabulous, and I'm very thankful to be able to talk to you. Thanks.
I will be back tomorrow with a brand new episode of The Valley Today, a few minutes after noon, so meet me here then.